kunye, historical text on kunye. I think this is important. We know what is our origin, or we know what is origin of this tradition. I believe kunye is one of the most ancient massage, type of like therapeutic massage. In the old Tibetan tradition, which still we can see sometimes in the nomad Tibetan people, how they are working with kunye. They use like different type of butter, different type of animals, butter or milk, or using very simple substances, and also sometimes people use different type of fat of animals and so on. So through this we see kunye has a very ancient history. And I would say also, like in the kunye we have dorje massage with stone and the sticks, and I believe this whole technique of the massage is dating back very ancient. But here specifically we can see some historical text on kunye, and one important thing is in the 8th century, the father of Tibetan medicine, Yudhoyonten Gombo, in his biography, he mentions about kunye. So he mentions 3 different type of external therapies, which are lum to chukpa, means lum herbal bath therapy, tu means hot compress, and chukpa means the massage, the kunye. And he says these 3 external therapies are coming from the ancient Shangshung kingdom, so that means in the western Tibet in the ancient time. So therefore we know, and Yuto said in 8th century, the kunye is an indigenous Tibetan massage tradition. And also in Yudhoyonten Gombo, he wrote the most famous medical text, which is called the Medical for Tantra. And this for Tantra, the last Tantra is called Final Tantra. There is one chapter about chukpa, or about kunye massage, and which is a complete chapter talking about kunye, which type of oil we can use, which kind of herbs, or which kind of formula, which type of decoctions we can use for which type of disease or imbalances. And not only that, this chapter, also in the third tantra is about pathology. So it in each chapter mentions what are the cause of problems, and what are symptoms, and what are the treatment, all these symptoms or the disease. And there we see in this third tantra there are many different type of disorders we can cured by kunye, so which is very interesting. Therefore in Jushi, medical for Tantra, mentioned very intensively about kunye massage, especially like therapeutic kunye massage. One interesting thing is the famous ancient Donghuang medical manuscript, which in this ancient text, which also showed some part of kunye, and specifically I found this in my own research. I was reading many times of this text, and in one point it is a Moksha text, and this one point it's talking about how we can make gu application, and then after we apply the oil, how to give heat through the sunlight, or from sunshine, or from the fire, and then after that how to make some nye. And so this process, application of oil, giving the heat, and doing the nye massage. So I think that is also important historical text. I said already there is an important connection between kunye and yoga, and therefore many tantric texts they mention about kunye. I would say especially like channel massage, or like chakras and channels massage, like special points. For instance, in the chakras we have 32 special points, which is mentioned by many tantric texts. And they mention this, how to make massage, and what is the benefit if we do massage, and so on. And another one is we also do this massage for the La energy, protective La energy, and where the La locations, and what kind of energy is this, and how we can do the massage, and so on. So therefore, Actually, whole complete study of Kunye is very intensive or very complete, because most of this Kunye part is coming from medical text, and also some of this part of Kunye is coming from tantric text. And to join this together, when we put this together, and then we can see the whole image of Kunye. It is a complete therapeutic and energetic massage. Here we see what is Kunye education. The Kunye is studied, Kunye study is a part of traditional medicine study, because when we study Tibetan medicine, we have to study the four medical tantras. If we study four medical tantras, and Kunye is mentioned in four medical tantras, and we study as a part of this Kunye, Kunye is a part of this medicine, part of the external therapy. So therefore, to finishing the whole study of Kunye, it takes many years, because you have to finish other part of medicine, and then Kunye also including with that. My teacher, the professor Jamian Lundro, so his father was called Lama Marchung, who was a Ngakpa master, Tibetan Ngakpa master, who was also a very good Tibetan physician, and who studied different things, like different type of Kunyes according to Tibetan medicine, also some type of Kunye according to yoga or tantric studies. Our teacher, he said that time, like he didn't have much, herbs or minerals to giving. He didn't have enough material for medicine to giving the patients. He was focusing more on the treating the patient through the Kunye and the massage and so on. So therefore he found his own this lineage. And also, of course, he had his family lineage, which is a very old tradition. So in the Ngakpa tradition, they handled this tradition from father to son and so on. And our teacher, he told us, especially he told us this Kunye as a independent therapy. So we can use as an independent therapy. And so especially when he taught us according to the special techniques and the way to how to work with Kunye. And then he told me I should complete with theories and so on. So therefore, I completed my Kunye text in Tibetan, so Kunye handbook. So this is my Tibetan text, and which was, when I finished this text, revised by my two professors, and it been also published. And now the Kunye education, according to International Academy for Traditional Tibetan Medicine, we have a very specific Kunye education. So the reason is this is specifically aimed to fit into Western society, and how we can use Kunye as its own body, independent body. Because of course, if we say it's a medicine or Tibetan medical part, to developing whole part of Tibetan medicine in Western society is not that easy, because of the restriction of the different laws and so on. So we have some difficulties to really present whole part of Tibetan medicine, especially pharmaceutical aspect. Therefore, we try to focus on Kunye, and through the Kunye we try to present